Xin chào, tôi là bác sĩ Kim Chi Su, người Hàn. Cảm ơn, tôi rất vui được gặp mọi người và rất vui ở hội thảo này. Cá nhân là tôi rất thích ở Việt Nam vì tôi có nhiều kỷ niệm rất đẹp và tôi nghĩ là Việt Nam là thời tiết rất đẹp và người Việt Nam thân thiện lắm. Cảm ơn. Dù sao thì tôi muốn nói là rất cảm ơn mỗi bác sĩ đã tham dự hội thảo này vào sáng sớm và Tông Bang mời tôi tới hội thảo này. Rất cảm ơn. Okay, introduction is till now. Now I can speak English. Till now, talking to some contents. I will speaking in English. Uh, uh, I'm the first speaker, and then today I'm going to talk about my topic is how to start a thread lift. So I'm going to deal with some basic knowledge for this thread lift. But I strongly believe the basic doesn't mean that it's very easy or simple, because I strongly believe that the basic is very essential and the fundamental knowledge. Based on this fundamental knowledge, we can apply, it gains the ability to apply the techniques or develop the techniques. So this is very important or essential. I don't think it works. Can you check this? Oh, okay. Okay. As I introduced you, I'm a doctor, a cosmetic surgeon in Korea. And 10 years ago, I think anatomic knowledge is very important. I realized anatomic knowledge is very important. And then important thing is the anatomic knowledge for surgery and the minimal invasive procedures are different. So the surgery, because the surgery, we can we can see all structures so that we can avoid risk. But the minimal invasive procedures are mostly performed by blindly. So that's why I think the anatomic knowledge for minimal invasive procedures are really important. So around 12 years ago, 12 or 30 years ago, and I started to work in anatomic knowledge with anatomy professor using the cadaveric study. And I published the first book with Professor Kim. But around 9, 10 years ago, I feel like I need more the customized knowledge for minimal invasive procedure. So I started to use ultrasound for individual customized plan for that. Now I'm still focusing on research using ultrasound with Dr. Wani here. And so now I'm still, my research is going on. Every year, an American association published, release this data, statistics, the numbers, how many procedures, how many numbers of aesthetic surgeries or the minimal invasive procedures. Of course, number one is still botulinum toxin. Botulinum toxin is number one procedures performed in the last year. The second one is hyaluronic acid filler. Hyaluronic acid filler, and then the other fillers are followed by. But interestingly, the last year, the aesthetic trend, they show that weight loss and lift. So weight loss is like there are the Wegovy or Mounjaro. It's a GLP-1 agonist injections available now. So this is very, very popular all over the world, of course, including the Southeast Asia. And the lift. I'm not pretty sure that the lift is followed by weight loss or lifting itself. But whatever in Korea or Southeast Asia, the lifting is facelift. Lifting is very, very popular. And so many patients who are ordering people are interested in the lift, facelift. Okay, thank you. I think in the minimal invasive procedure, there are three axes in minimal invasive procedures. The first one is toxin, and second one is filler, and the last one is the thread, especially in the Asian country. Wrinkle are the representative aging signs on aged people. So especially it is noticeable on the upper face. So we are using the Botox, botulinum toxin, to smoothen the line. But mid face, the volume loss is more noticeable than the upper face or low face. So that's why the filler, especially hyaluronic acid filler, is very popular. So, but third and the lower face, sagging is most dominant. So improving the sagging, we can use nowadays a thread. A lot of various kind of thread is available now, so that we can use thread to lift the low face. But in Korea, I think besides of three axes, toxin, filler, thread, and then the other treatment modalities are popular, like this, fat dissolving injection, especially on the double chin or the fat area, the low face, and laser, the energy-based devices like ultrasound or HIFU or the radio frequency, or nowadays the microwave is very popular to tighten the skin or the lifting purposes. And in Korea, the skin booster, kind of the collagen booster or a collagen product, using the air jet or the injector is also very popular. We can now want it to improve skin quality or the fine wrinkles. So this skin booster, like here also the Exoderm is popular. I've heard about that. And the Juveru or whatever is a kind of skin booster or collagen booster is very popular. Still, the PRP or stem cell is still our options. Before the thread lift, we need to understand the aging signs. Aging signs are categorized in two categories. It has two categories. The first is skin level. It's a pigmentation problems or some wrinkles, dynamic wrinkles, but it's not a topic for pigmentation. Pigmentation is not a topic at this time. Nowadays, we are focusing on the structural changes. And the first one is deep wrinkle. It is not a real wrinkle. It's just like fold or depression. It's caused by three-dimensional changes. And then, as I mentioned before, volume shift. Volume redisposition happened, which means in some part, volume is accumulated and some part, volume is deflated. So we need to understand what happened in the face as people aged. And the sag, as I mentioned before, especially focus on the low face and the nasal effort, and we can see the sagging is very noticeable. So can you see some purple color means in the volume deflation part, and then the red color means in the volume accumulation part. So as people aged, and a reverse triangular shaped and a triangular shape in old age people. So, but in some part there are some tight tissues on the face. We need to understand it is something to do with retaining ligaments. So some structures or some structured tissues above, and this tight tissue can start to die, going down. So that's why bulging is noticeable in the aged face. So one of our goal is to lift and this bulged tissue. So before starting the thread lift, we need to think about what is the thread lift of thread lift. When patients, for example, when patients visit me, so I wanted to lift my face. I think nowadays I feel like I'm sagging. It's very noticeable, and then I feel like sagging. My concern is sagged. So we show that the lift or the arm make you like this, and the lift like this. Okay, this is a lift. Yeah. Lift means lift against gravity in the gravity, but like this. And then my question is, how about the sagged skin, the excessive skin like this? Excessive skin can be removed by surgery or facelift surgery. So which means that thread lift has a limit. We cannot remove this skin. So the thread lift can, so the nowadays concept of thread lift is, it's not a real lift to the skin. It is subcutaneous fat tissue, the redisposition. That is more the close concept to the thread lift and realistically. And the lifted skin, and we can fix this lifted skin with using the multi-directional cork thread. And the lifting is, I'm sorry. Lifting is main effect, but thread also has a tightening effect. Tightening means regeneration effect or the fat reduction effect. Usually we can use monothread for this effect, tightening effect. Or we can expect volume effect, especially for nose or wrinkles. This is very additional to heighten the nose or some filling the nasolabial port. We can use the volume type thread. So how does lift the work like this? And the lifting concept is we have target area. Target is, which means that we want it to lift, and the target area to the target area, which means the hanging point, should be the going up, the upside, lifted upside. And then in the fixing point is a lifted structure should be the fixed or anchored in this side. And so that we need to understand where is fixing point, where is target, where is hanging point. Of course, we want it to lift from target to the fixing point. So in terms of efficacy or result, good result, how to create a fixing point? That is a really important question for thread lift. But we also understand realistic goal for thread lift for ourselves and for patients, because some patients have very unrealistic expectation for thread lift. So like this or this, but this is impossible. We understand that. Also, we need to explain to patients what is limit and what is effect for thread lift. So, for example, a lot of voluminous space and then a thread can have a limit because their patients need the fat starving using the injection or the surgery. Fat surgery, or if patients have very skeletonized face with a lot of skin laxity, also it is also very hard to treat. Some patients need some volume replacement, so that we can use combination with the filler and the thread. So we need to understand. So we don't need to use only thread. We can use other treatment modalities like the filler or the other energy-based devices like oil therapy or the fat dissolving injections. Now I move to the anatomy knowledge. I think we are all doctors, right? All of them doctors. I think we are a doctor. I think the difference between the doctors and aestheticians are anatomy knowledge. And very solid doctors with solid anatomic knowledge, we can apply this knowledge and then develop the technique more about that. So the fundamental anatomic knowledge is very, very important. But as I mentioned before, the anatomic knowledge for surgery and minimal invasive procedures are different. So what we need for the minimal invasive procedures, especially at this time, the thread lift, I wanted to talk about this. As we know, the skin layer, this is very basic. Skin is well-known knowledge. Skin is 5 layers. The upper part is skin, as we know. The deepest part is bone, or above the bone, periosteum. And just below the skin, the second layer is superficial fat. Superficial fat has we can easily understand the superficial fat, skin, and below the skin is superficial fat. And below that, the muscle, we can see the muscle and the covering fascia, the aponeurosis, system, a neurotic system covering the muscle. Oh, okay, that is okay. The facial, there are a lot of some facial muscles on the face to the creating the facial animation. But the headache is the fourth layer. Fourth layer is a deep fat. The below the in some part in the below the muscle, there are deep fat here. So we need to understand this so that that's why where I am or where I want to inject filler or where I want to insert a thread on which layer. So for this, and we need to understand this. But just we think, oh, we know about that or anatomy about that, so that we can easily understand and the bone and skin and subcutaneous and muscle. But the deep fat is special, the structure for this. And then there are some space is created, but space is usually collapsed. And we can use cannula to widen this space. But this space, prezygomatic space, or okay, thank you. Prezygomatic space or premaxillary space, that is important for fillers. So in the thread, we forget for a while. And the next superficial fat compartment. And the right picture shows that superficial fat has some compartment like that. But in the gross anatomy knowledge, fat is very continuous all over the face. So we cannot see any compartment with the naked eyes. Subcutaneous fat is like that. And if subcutaneous fat is removed, we can see the facial muscles like orbicularis muscles or others. Also, skin subcutaneous fat is not consistent. In each part, the subcutaneous fat thickness is different. As we can see, the blue color in the right picture, you can see the right picture, and the blue color would mean they're very thin around my eyes or around the mouth or the forehead is very thin and subcutaneous fat. Of course, the skin is thin, and the cheek part, most cheek part and lateral cheek part, the subcutaneous fat is pretty thick. The deep fat, as I mentioned before, some doctors say that deep fat is hard to understand, but I want to say that deep fat is only three part. Only three part. Yeah, first part is around the eyes. Around the eyes, below the orbicularis oculi muscle, the upper part, the roof, and the lower part is suborbicularis oculi muscle, awfully fat. And that is first part. And the second part is midface. Midface, deep medial cheek fat in the lateral part or medial part, or whatever in the middle part, deep medial cheek fat exists. And the third one is buccal fat. Buccal fat create the facial contour like that. So if very thin and skeletonized face, and they don't have a lot of buccal fat. And buccal fat, or the fatty face and chubby face, and is more likely to have more buccal fat. And buccal fat extended to the temple, but whatever, buccal fat is deep in the cheek area. It's located very deep cheek area. So again, around the eyes, roof or soup, and then mid part and deep cheek fat, deep middle cheek fat, radial side or middle side, whatever, and deep middle cheek fat, and then on the cheek side, buccal fat, and extended to the temple, but whatever, and here, mostly you can you can see the buccal fat here. So some space I want to skip this, and mostly this space is created around the deep fat area. Now, SMOS is very important. Still, I've heard that some doctors have talked about the SMOS is very vague and SMOS is unclear. But obviously, in the dissection, the cadaveric dissection, we can see the one membrane wholly covered the whole face. Of course, this is a very important concept for thread lift as well as facelift surgery. So I think it's a very important key structure for the facelift. The SMAS is, as I mentioned before, it's one membrane covering the whole face. So it is continuous with the frontalis muscle, and the temporal side is continuous with the superficial temporal fascia, in other words, a SMAS, and is continuous with the whole cheek area. But in the medial side, it continues with muscles. So we can think SMAS is the muscle level, the facial muscle level, the frontalis in the upper part, the frontalis in the middle part, orbicularis oculi muscle or the other animation muscle, elevator muscle, and the lower part it continues with platysma muscle. So this is one membrane to covering the whole face. So as I mentioned before, this is a key concept for facelift because this is continuous. So if we lift this membrane's mass, we can expect and the lifting effect. The fascia, the temporal is pretty complicated to understand because besides deep fat, and the fascia has two fascia layers, superficial fascia and deep fascia. Superficial fascia is the like SMAS, it's continuous SMAS. Deep fascia is just above the muscle, the temporalis muscle. Also, the deep temporal fascia has two layers, superficial layer and deep layer. And between these two layers, it has temporal pad. So that's why it's a little bit complicated. But whatever, temporal is the most common place to insert the thread. So we need to understand where I want to insert the thread. So that's why the temporal anatomy is pretty complicated. We need to understand that. But the superficial temporal fascia is just below the subcutaneous fat layer, and the deep temporal fascia is covering the temporalis muscle. So, which means the deep temporal fascia is more the thick and the more is tough. So the tough membrane. So which means this is very the good candidate for the thread to be anchored. So we need to understand about that. And then the others are some septums, superior temporal septum or inferior temporal septum, and some adhesions like this. And so also we understand that this the adhesion can exist. And the next one is retaining ligament. When it comes to retaining ligament, I want to compare with this down jacket padding. As you can see, this has padding jacket. Of course, here the Temple Ho Chi Minh it don't have any winter season, so we don't need to wear this down jacket. But mostly we can see the down jacket. We can see some stitchings like that, stitching here, regular stitching like that. Okay, think about that. Without stitch, if there are no stitches, maybe the feather or the padding inside were going down in the bottom. So, okay. And then comparing to this down jacket, or think about it in the face, if without any retaining ligament, maybe it's subcutaneous fat at the fat compartment going down and then it will sink in the bottom side. So it's a retaining ligament and then make some compartment like that. So that's why it creates some volume here. But as people age, the retaining ligament is still there, but the other subcutaneous fat started to sag. So that's why bulging is noticeable in old aged people. The basic concept of retaining ligament is like from the periosteum to it attached to the skin. That is what we can call the true ligament. But nowadays, the concept is a little bit changed. In some parts, it's like left picture from the bone to the muscle level is very strong, like tree, a trunk of tree. But in the subcutaneous part, it's like a lot of branch attached to the skin side. And some part in the deep fat compartment and deep fat compartment retaining ligaments is weak or obliquely oriented like this. So depending on these characteristics, we need to understand what is target for thread, what is target for filler. And as people aged, as you can see, in the deep fat is the volume is reduced, you can see. And then a little bit, the retaining ligament is weakened. But in the superficial fat, fibrous septa is more weakened. So and then the subcutaneous fat is increased. So it can create a groove like this, uneven contour on the face. So we need to understand that. Okay, deep fat is reduced in aged people. Deep fat is reduced, but subcutaneous fat is the sink down, going sink or down. So some part is volume accumulation happened. So with all of these changes create an uneven contour on the face. So based on this idea to how to handle this problem, we can get an idea. So this is the 3 steps. I don't perform surgery, I'm not a surgeon, but we can get some idea from the facelift surgery. There are 3 steps of facelift surgery. The first target is subcutaneous fat. We need to lift subcutaneous fat. The next one is SMAS. Target should be SMAS. And then third one, the last one is subSMAS part, and we can lift the whole structure like that. Of course, this is the strongest method, but it's only possible with surgery. So for thread lift, so we can use, target should be the subcutaneous, at least the subcutaneous, and then maximally the SMAS should be the target for the strong effect for thread lift. And then now I want to talk about some important structures we need to avoid while inserting thread. First thing is nerve. Facial nerve is motor nerve, and the trigeminal nerve is sensory nerve. It is different, but sometimes the facial nerve, motor nerve, and sensory nerve intermingled. So that's why the motor nerve is injured, damaged, some drooping can happen, but also the sensory problem can happen as well. So, but whatever, we cannot distinguish very clearly. But of course, in face, motor nerve is a facial nerve. Facial nerve has 5 branches, and the trigeminal nerve is 3 parts: ophthalmic part, and maxillary part, and the middle part, and the lower part is mandibular nerve, innerve in the lower part. As I mentioned before, the facial nerve has 5 branches, but the other branches are traverses very deeply the inside, the parotid gland. Parotid gland is very deep on the face. So if we approach the subcutaneous layer, we don't need to worry about too much about the damage of facial nerve. But the one thing, the temporal branch, the opposite part, temporal branch, is traverses to the zygomatic arch. So which means that it can injure, when you insert a thread, it can injure the temporal branch of facial nerve. So how can we, as I mentioned before, this temporal branch is injured. Maybe the eye drooping can happen like this. So that we can, some triangle for the temporal branch of facial nerve is well known, but it's hard to avoid completely. So we need to think about the depths. So mostly temporal branches is just above zygomatic arch. So exactly it traverses space between the deep temporal fascia and the superficial temporal fascia. So if you insert a thread and you insert a thread along the subcutaneous layer above the SMAS, mostly it's very less likely to happen. The temporal branch injury, the less likely to happen. So we need to understand the depths as well as topological innovation. And the other important issue, I think this is one of the most important structures during the thread lift, because parotid gland and duct is located very deep, but lately I and Dr. Wenli, we published a journal during the thread lift. The thread can penetrate the parotid gland or the injured parotid duct. It can can lead to very serious problems like that. So we need to understand where the parotid gland or where the parotid duct is. Mostly it's very deep side, and below the deep temporal fascia or the deep parotid masseter fascia. So we don't need to worry about that. But inadvertently going to the deep side, it can injure to the parotid gland and parotid duct. And parotid duct, so you can see in the middle part of zygoma below the 1.5 centimeter below. In this part, we need to be cautious about that so that we can traverse the thread lift, and in this part, meticulously be cautious to the superficial or the subcutaneous fat layer above the SMAS. As you can see, this is very deep. So before the paper published it, I just thought that, this is very deep side, so I don't need to worry. I didn't need to worry about that, this parotid gland injury or parotid duct injury. But as I can show this ultrasound image, and it's not too deep. It's inadvertently deep inside, and maybe it can injure the parotid gland or parotid duct. And then nowadays, there are a lot of patients who has received surgery or the other the procedures like thread lift or the filler procedures. So the normal anatomical structure changed. So that's why I wanted to talk, and we need to be cautious. But keep in mind, just keep to the above the SMAS, relatively safe. So in terms of SMAS, as I mentioned before, above the SMAS, this is just a subcutaneous fat. So if you are a beginner or you just start thread lift, just keep to the layer. It should be the subcutaneous fat, above the SMAS. Of course, in the close to the SMAS, it can lead in a strong effect for thread lift. But whatever, above the SMAS is relatively safe. Below the SMAS, you can see the fascia, the nerve, or the parotid gland, the parotid duct, so that we need to be very cautious. Of course, in the surgical field, we can see these structures, so we can avoid. But the thread lift or filler is blind injection, so that we need to consider. So now let's move to the vessel, blood vessel. In the temporal area, only concern is superficial temporal arteries. Superficial temporal arteries can be injured, but this is not a filler. The filler cannot enter the blood vessel arteries, so it can cause some problem, serious problem like blindness or the skin necrosis or embolism. But we don't need to worry about too much about that. But of course, that doesn't mean that we don't need to care the blood vessel. Of course, we need to understand the location of the superficial temporal artery. Of course, this is also the Dr. Wenli and I published this journal. The conclusion is just like this. Inside the hairline, the 75% of superficial temporal artery exists. So mostly the 75% patients have the superficial temporal artery inside hairline. So in the meantime, I prefer the entry point and outside of hairline, and so that it's more safe. Of course, filler also same. Some doctors inject filler on the inside hairline, but I don't prefer that method. So, and then the other 25% in anterior part of hairline or at the hairline. So without ultrasound, we can touch in the skin side and they can feel the palpitation for superficial temporal artery. Chin is pretty simple. Of course, the chin and the neck area anatomy is very complicated. But as an aesthetic physician, we don't need to think about too much. We don't need to know about the whole the neck muscles. Only our concern is subcutaneous fat only. Subcutaneous fat below this and the platysma muscle, so the target thread lift for double chin is target should be the subcutaneous fat layer. And this platysma muscle is very thin and loose, and sometimes this muscle in the middle side muscle doesn't exist. But that is important for toxin, not thread too much. And submandibular gland, but this is really very hard to injure, the submandibular gland. Only this can be the target for reducing the volume with botulinum toxin. Oh, okay. This we learned about basic anatomic knowledge for thread lift. Now let's move on to the thread itself. When it comes to thread, when you think about thread, and this is on the left side, this is very common thread type nowadays. The thread is folded inside the needle, and then we can insert the needle under the skin and pull out the needle, and the thread still exists there. I can get the lifting effect like that. And the others are nowadays on the needle and attached to the thread. This type is available, like Silhouette Soft or others. And now, also some doctors still prefer the long thread like this. But my category is different. First of all, we need to divide and the non-absorbable the thread or absorbable thread. Personally, I think non-absorbable thread is like some surgical procedures. So I don't recommend a beginner can use non-absorbable thread because of the strong effect. Because non-absorbable, which means this is very strong and very firm, so that it can cause more likely to happen some foreign body reactions. It can also can move down, or it can easily penetrate to the skin. It's very hard to remove, and the only surgical procedure can remove this, the non-absorbable the thread. So that's why I forget at this time. I want to talk about how to start the thread. So to forget about non-absorbable thread. Only we focus on the absorbable thread only. It's different ingredients. There are different ingredients like PDO or PCR or PLLA, but whatever, this is biodegradable. Biodegradable, which means that with time goes by, it's gonna disappear. Yeah. At least 6 months to 1 year or 2 years. I categorize the threads, or 3 categories. I think there are 3 categorized thread. The first one is monothread. Monothread, of course, it doesn't have any coil, so which means it doesn't have any lifting effect. It has only regeneration effect or tightening effect. We need to understand first what is the purpose for using this thread. Mono thread, as you can see, the first mono is like very simple mono thread like this, and with time goes by, screwed type or other double twisted type is developed. But nowadays, volume type thread, mono thread is pretty popular. Cylindrical, the massy thread, or the spring type thread. Spring type thread is like is a thread coiled with around tightly coiled around the needle, and the broom type is a thread. The working the 12 or 14 thread at a time, and braided screw, the twisted cord is like a braided type monothread. It has a physical effect, and the place the injected more thread is contracted more, so that it's physically moved to the contracted side. But I don't think this is very strong effect. It's just we can understand that this can happen. And then the other technique is like insert the mono thread in the twisted pattern, so it can cause some more the collagen generation more. So we can expect the regeneration effect more. But it's just a basic concept. And a couple of years ago, several years ago, the Korean doctors published this journal. So the monothread, what is monothread effect? Histologically, they proved this effect. The first one is neovascularization, which means the vascular component is increased. And then collagenesis and collagen regeneration happens around the places thread inserted. And the fibrous, it can create a fibrous bridging, so that it can lead lipolysis effect, fat reducing effect. So that is what we expect while using the monothread. And how about multi-thread? Multi-thread and insert more thread, it can cause more collagen synthesis. It can create more collagen synthesis. So that's why nowadays multi-type of monothread are popular now. Also, this multi-type of monothreads can have the scaffold effect as well. The second thread type is I-type cork thread. As I mentioned before, if it has cork, it has ability to grasp the skin. So that if you are using the cork thread, if you want to use cork thread, we can expect lifting effect. Nowadays, this type 23 gauge or 18 gauge or 6 centimeter very short or the 10 centimeter length, or the thread thickness is 3 or USP 3.0 or the USP 2 size. Mostly nowadays we don't use needle, we don't use cannula type. As you can see this, and then this thread is cutting type or molding type because we want more strong effect. So the molding type is more stronger than cutting type, but it is developing technologically. It is developing how to create a more strong effect. But in a punching type nowadays, this kind of cork threads are available now. And then in terms of the direction, for the first time we're using unidirectional type because it has the lifting effect, but it doesn't have a fixing point. So nowadays we don't use that because without fixing point, it can move to the down. It cannot fix, it cannot anchor on the skin. So nowadays, bidirectional, the thread is widely used because it has the first part, it can lift, as I mentioned before, it can lift the target area, and then the upper part and the fixed in the fixing point. So that's why we're using bidirectional, the type of thread. And the multidirectional is like it has many different adverse direction of a cork. Multidirection cannot lift skin too much, but it can fix, it can anchor in the lifted status. So nowadays, bidirectional cork or the multidirectional cork is widely used. Okay. Need to check. So this I-type is called. This is widely used in some one cork, but this double cork has a little bit stronger effect to grab the skin. So I prefer the double cork type threads. So this double cork type thread, you can see the below photos. It lifted like that, and in the middle part without cork. It's elevated like that. So the last type is dual needle or long thread. It's close to surgery, so I don't recommend beginners or who want to start and the thread lift, and because we need a lot of surgical instrument like this. And then this question, how to solve this problem, how to make a physical fixing point, because as I mentioned before, with the fixing point, it has more strong effect. So how to make, it's not a surgery, so how to make a physical fixing point, this is really important. So, in this dual time needle or the surgical procedures, we can easily make fixing point. But the I-type cork thread is very hard to make the fixing point, but we have some idea. The first is a gathering effect. As I mentioned before, the targeting part is a lift effect, and in the upper part is a fixing effect. So like a gathering like this. So in the middle part without the cork is elevated, volume elevated. So that's why I mentioned that thread lift is a subcutaneous redisposition. In the low part, the second part should be the lifted, and then where is the lifted, where is the sagged part? It is moved to in the middle part, in the upward like this. So this is not a surgery, as I mentioned before. It cannot remove the excessive skin or root the skin. So its concept is more close to subcutaneous redisposition. And then in this fixed part should be anchored in the firm tissue. Like where is firm tissue? Firm tissue is mass or the deep fascia or the dense ligament, retaining ligament. That can be the target for the firm tissue to anchor the retaining ligament here. And in this I-type cork, we can use this idea or tie to create a fixing point or knot, or angle, create angle, or the reinsert in the tip of thread. We can use this to make more strong effect. And then this type of thread, and it has cone, so the cone also play a role to the anchor point, so that we can use this type of the thread to make more strong fixing point. So what are the factors to influence the result? Of course, the first one we can consider material, but as you're a beginner, I recommend PDO. PDO is better. PDO is very biodegradable, and the others are a little bit hard or last long, but the PDO is, as my experience of 10 years, and then the PDO is most biodegradable, which means it's safe. And then, of course, the thicker the thread, the more stronger the effect. And the manufacturing process also can influence the result. Well, cutting mold or the cog or the 360 degree types of spiral type or molding type, or how many cog they have, or the injection depth, or the thread vector, or the fascia selection is also important. We'll just think about this ingredient a little bit more. As I mentioned before, I prefer the PDO ingredient because this is very safe. It lasts only 6 months, but around this PDO inserted, and it can create collagen synthesis. So we can expect the effect result up to 1 year to 2 years. As you can see, this protrusion can easily happen like this, but a couple of months later, it can spontaneously dissolve. We don't need to worry about that. We don't need to remove, and we don't need to remove like this, just the massage or the weight. So mostly PDO ingredient, in my experience, will disappear. So that's one of the safe ingredients. So that's why I prefer the PDO thread. Before the procedure, anesthesia is important. Of course, reducing the pain, minimize the pain. For me, I prefer the tumescent solutions like this and the local anesthesia, because I don't want my patients go through the nightmare during the procedure because they don't want to come back again. But this is minimally invasive procedure, so though in doctor's position or a clinical position, financially, the patients again and coming visiting again and again is better. So that I want to care. My concern is how to take care of pain, and this is really important. So the local anesthesia using the epinephrine is also prevents bruising. This is good, but using the epinephrine itself is very strong, or it can cause heart rate increasing. So I want to use a diluted anesthetic solution, which means that it is a tumescent solution. And the methods are different, but whatever, I prefer the tumescent anesthesia. As I mentioned before, if you want to start to insert the thread, target should be the subcutaneous, above the SMAS. But if you get used to it, and maybe you are trying to dip a little bit more, but close to the SMAS layer. If you insert the thread close to SMAS layer, it has more strong effect. I think this is the most important in our surgical techniques, because in the doctor's concern is like it lasts very short, so it going down again very fast. So we insert and thread just closes the mass. It can have strong effect, and then different layer, the multi-layer insertion is one of the tool to lengthen the thread. But we are inserting blindly, so we need some tool to understand where I am. So this is very good tool. The pinch technique is just gentle pinch, and using the fingertip and pinch like this. Only subcutaneous, we can grab the subcutaneous fat. But deep pinch using the finger joint like this, and it can grab this not only subcutaneous fat, but also the SMAS layer, and including blood vessel. So we need to understand the gentle pinch or deep pinch, and so we can guess where I am. This is very useful tool. Okay, as I mentioned before, the anchoring point, the candidate for anchoring point is very tight and firm tissue. There's this deep temporal fascia, and below the zygomatic arch, this is very, the superficial temporal fascia and deep temporal fascia attached like that is very firm tissue. And then platysma auricular fascia also, these three parts can be the good target for anchoring points. And the ultrasound show that the first one is very deep to the SMAS layer, and then the others are ideal to just above the SMAS layer, and third one is superficial, well, too superficial like that. And the other, what we consider is when patients are lying, the original jawline should be positioned in the superior side, lifted like that. And so if we want a very gentle or just natural result, and then just fixing the lying position is enough. So for me, sometimes some patients want very natural result, just using the multi-directional cog threads for the fixing purposes. The cutting, of course, important to prevent a dimple side, deep inside cut. So without this, and then it can, the graft, the dermis layer can create a dimple. The mostly target application, the indication is jaw or the nasal level fat or the eyebrow, or nose. And if you're just a start and thread, and I don't recommend nose. If you're familiar with the manipulation of thread, and then if you can you can use more indication. For the first time, just the jaw and the nasal labial fold, or that is the first indications, and after that, and you can try to the brow lift or nose or others. This is my usual entry point. I want to use a very simple entry point like that, and just 3-4 entry points like this. Or the second picture, sometimes I want to use a reverse technique like that, and for chin and reverse and high to low and low to high techniques like this. But as I mentioned before, I want to create an entry point outside the hairline, because the preparation is very hard and burdensome, or some nurse, we need to train the nurse a lot, but sometimes it can cause some problems like infection, because the hair can enter the entry point or others. So for minimal invasive procedure, in the concept of minimal invasive procedure, I want to avoid infection or other problems. So that's why I prefer just outside as entry point. The mono threads, it's just insert a lot of mono like this. So that sometimes I insert 100 or in the neck and 200 like this. And as I mentioned before, it doesn't have any lifting effect. It only has regeneration effect or tighten the skin. This the volume thread for the wrinkles, deep wrinkles, it can create a little bit volumetric effect, but I don't think it's regeneration effect more than the volumetric effect. So the eyebrow or the deep wrinkles or forehead or glabella or in this side for regeneration purposes, we can insert in the nasal flathead side or jaw side. Yeah, this is kind of almost the same, like injection direction, insertion direction is using the cork threads like this. Before injection, as I mentioned before, in the middle part of bidirectional cork, no cork, so it's elevated volume. So we need to figure out where is the middle part, which centimeter from the tip and which centimeter from the end. It's simply the reverse technique is like this. Target is sometimes it can be a deep, the space between the deep temporal fascia and the superficial temporal fascia, like this. Oscillate just below the zygomatic arch. You can as a insert the entry point like that. This is a very simple the vertical vector like this. So in the eyebrow side and the eyebrow meeting the hairline, just outside the hairline, and then create the entry point. Sometimes I can use the tie technique, but nowadays I usually don't use the tie technique because this knot is very noticeable and then palpable. So sometimes it lasts for a long time. So the patient feels uncomfortable for this knot. So I think the layer and the multi-layer is more important than making the tie. Of course, oblique vector is like that. It's just above, just in front of the tragus. So create or tragus or the below or the above, and can create the entry point and insert thread. Oh, sorry. Yes, the technique is almost the same. And lastly, I want to simply deal with some side effect. Some lump can happen, like an entry point or the dimple. Dimple can happen. But as I mentioned before, why I prefer the PDO ingredient is some lump. Mostly it can disappear when time goes by. A couple of months later, it can disappear. The inflammation is not that common because before the procedure, we need to care the clean, very clean, and sterilization. This is really important. Sometimes eye drooping or neuropraxia can happen, but it's just a tingling sensation can last for a couple of months. But mostly, nerve injury is not that common. So that we don't need to worry about that. It's just, I recommend keep your cannula on the subcutaneous site, so you can easily start thread lift. Dimple is some superficial part to grab the skin or dermis. It can cause dimple, but in the early time, and we can pressure the skin, and we can release in the grabbing site. So you can easily handle that. But after one month later, it's very hard to handle. So if patients complain about the dimple problem, so ask the patient to visit as soon as possible, can handle this problem. So mostly we can handle. Also, after 1 month or 2 months, you can use some dissection with the cannula. This is also helpful to smoothing the dimple. And protrusion like this, sometimes you can remove the tip of thread, but mostly it is okay. If you're using PDO thread, mostly it is okay. So important thing is to prevention. To the deep side cut is really important. And then this is the nose is very popular. It can move like that and protruded like that. But even though it is, and if patients are tolerable, and just wait or massage and wait, and so just 2 or 3 months later, it can disappear. If you are not a surgeon. Okay, this is the last slide. Sometimes a protruded thread like this, and the right side, this is permanent, the non-absorbable thread. It's very hard. It can penetrate the skin. I think she needed surgery to remove this non-absorbable thread, but it's very hard. So if you start to use thread lift, and I recommend PDO, its ingredient, because this is very biodegradable. We don't need to worry about that. But if PDO thread and protrude it like that, and so you can grab using the pinset or the forceps and then cut. That is enough. It's not that complicated. Okay, my talk is end now. So I hope that this knowledge, anatomic knowledge or basic concept of using thread, and how to start the thread can be helpful for your clinical practice. Thank you.